welcome to the session. I'm really pleased to be coming here and talking to you this evening. I will be introducing myself in just a moment, but I'm just going to have a look actually at the comments box to see. So if you've just joined, if you can pop into the comments box, the age of your baby would be really useful. I can't see any comments in there at the moment. And if there's anything particular that you want me to cover today, I will absolutely be leaving some time for many questions at the end, so you'll be able to pop them in there. So 8 months. And it would also be really useful to know how it is that your baby's going to sleep, if they're going to sleep on their own, or if you're helping them, whether that's through feeding, rocking, or holding, or in the pram, or anything more elaborate. That would be really useful to know as well. Right, I'm going to get on with the presentation. I know that people are going to be joining you. Everybody is doing bedtime around now, so I totally appreciate that. So that's not a problem at all. So a little bit about me first. So my background is in paediatric nursing. I qualified from Guy's and St Thomas's Hospital back in 2000. I am a member and I am insured through the Royal College of Nursing. I'm also a nutritional therapist. I did 3 years postgraduate studies in nutritional therapy and weaning expert. I've been teaching weaning classes and I've been teaching feeding classes, fussy eating classes, classes for making baby food and lots of other things through Sure Start Children's Centres for a long time now. I've also been a sleep expert through my previous business, Yummy Baby Group, and now Sleep Well with Hannah for the last 15 to 20 years. And I have 3 children. This now needs updating because they are a little bit older than that. So the decision for this talk today, when I was sitting down and deciding what to do, was I was deciding whether or not I should do a general information or whether I should offer an actual practical solution for you. And I've decided to do a little bit of both. So what I'm going to be doing is I'm just going to have a look at the comments box because I've asked you how babies are going to go to sleep. So we've got 7-month-old on chest sleeping, feeding to sleep. Sleeps with the last feed, all really common. So it's always in these sessions, it's always some bouncing, there's some gym balls, there's some prams, there's some contact napping, and I can see that that's the same in this session too. So the first thing that I want you to do when I come to these sessions is, and I know that everybody always finds this very strange, is I want you to forget everything that you've read about sleep before. The reason for that is information is amazing. You can see that you're not alone. You have the confidence to ask for help. So when I started helping babies sleep well 15 years ago, there was really no information around. You Googled sleep trainers, nothing came up. The only person that you could really go to with health visitor, and they would just know about controlled crying. And in a way, that was easier for parents because they were there was less information out there, so you didn't fall into the try everything approach. And I'm going to go over what that is in just a moment. But the bad downside of it is people really didn't have the openness that they do about sleep now. And nowadays, the good thing about there being a lot of information out there is you do have somewhere to go to. You know that you're not alone in your sleep issues with your baby. You know that this is quite normal to struggle with your baby, and people are more than happy to give me testimonials and not use any fake names anymore. But it does lead to the try everything approach, and I'm going to give you a little bit of a scenario here, and I'm sure that many of you have been in this scenario before. If you have, put your yes into the comments box. And that is when you try to decide that you've had enough and you've got to change your baby's sleep situation. Say, for example, you're feeding to sleep and you just want somebody else to be able to put your baby to sleep, or you want somebody else to take over in the night. And you think, right, I'm not going to feed my baby to sleep. And you start with a little bit of bouncing and then a little bit of rocking. And then you do a little bit of shush pat, and then you do a bit of pick up, put down. None of that's working. So you walk out the room, you do a little bit of cry out. You can't leave that for that very long. And so anyway, you end up going back to the feeding. And this is what I call the try everything approach to sleep. And unfortunately, the try everything approach to sleep is never going to help your baby sleep well. There was a big piece of information in America very recently, a big research paper done on sleep. And the one thing that they showed is it doesn't matter what approach you take, as long as you're consistent with that. And this consistency is absolutely vital. So what I want you to do is I want you to forget all of the other things, pick up, down, cry out, furber, shush pat, anything else. I just want you to forget all of those things and really focus on one way of getting your baby to sleep. And this is C of my calm approach to sleep. The other thing as well, which is a difficulty with lots of information, is it leads to lots of false information. Things like sleep training can damage my baby. Self-settling is developmental. Babies can't be trained. They learn not to call out. These are all false statements and then completely untrue, especially when you're talking about gentle sleep training that isn't involving leaving babies to cry like my approach is. So just to do these are things that I hear all of the time. So sleep training can damage my baby. There has not been one piece of research that shows that gentle sleep training can damage babies. This stems from the raising cortisol levels, which is associated with leaving babies to cry. Just to say that every single time that your baby cries, there's going to be a raising cortisol level, but doing it for an extended period of time with you out of the room has been shown in some studies to raise the cortisol levels, but then give links to having it damage your baby. I still, even though I don't ever, and I have never advised controlled crying or leaving a baby to cry, I still don't believe that this is going to damage your baby any more than having a baby that is screaming for 3 hours a night because they can't go to sleep by themselves. So there's a little bit of food for thought there as well. But what I'm advising today isn't going to be to leave your baby to cry out. The other thing that I hear all the time is self-settling is developmental. Again, this is absolute rubbish. I have previously worked in neonatal intensive care, and all of the babies there had the ability to self-settle to sleep. Of course, we occasionally rocked them and we occasionally held them and occasionally they would fall asleep having a feed, but we could also put them into their cots and we would see them going off to sleep by themselves. All 3 of my babies self-settled from day one. I didn't rock them to sleep. I didn't feed them to sleep. And I have now been helping babies with from newborn, from before the parents have the babies, mainly because parents come back to me and say, oh my God, Hannah, you helped me with our first and we've just found out we're pregnant with our second and we don't want to get into those habits again. Can we do this from the beginning? And so for the last 10, 15 years, I've been helping babies learn the skill of settling independently from day one. So self-settling is definitely not developmental. And then finally, if babies can't be trained, they learn not to call out. Anybody that's been through a sleep training program, especially one of my own, will tell you that if your baby needs you, if they're cold, if they're hungry, if they're poorly, if they're in pain, they will absolutely 100% call out. But they don't need to when they learn to sleep well. So sleep training. So why sleep train? Why do I feel it's important for baby to sleep train? First thing is to say that this is your choice. There is nothing wrong with co-sleeping. There is nothing wrong with feeding to sleep. There's nothing wrong in holding your baby to sleep or contact napping. But normally when parents come to these talks, they've got to the point where what they're doing is not working for them. So as a sleep specialist, I am here to offer you a solution to the problem that you have, not to tell you how to parent your baby. So if things are working, then you absolutely continue to do them. If they aren't, then I'm here to show you how you can resolve the issue and why does sleep training work. So the first thing to say is it is perfectly normal for babies to wake up. It is how it is safe for them to sleep. Babies need to wake up many times a night. It regulates oxygen levels. It protects against SIDS. So it's really important for your babies to be waking up after short sleep cycles for nap times, waking up 10, 15 times a night, waking up early morning, and this is perfectly normal. Sleep training, we're not trying to get your baby to sleep through. We're not trying to get them to take extended naps. That is how adults sleep, and that's why your baby's sleep is completely incompatible to yours, but it's not how babies sleep. The idea of sleep training is to get to the point where your baby can go into their cot completely awake, no cuddles, no milk, no rocking beforehand, and go to sleep on their own in their cot from being fully awake. Once they can do that, they'll be able to bridge these sleep cycles. They'll be able to take longer naps. They'll be able to resettle themselves overnight as well. So that is the aim of the sleep training. You do have a way, this is why I asked a question at the beginning, everybody has a way of getting their babies to go to sleep. That you taught them how to go to sleep like that. And sleep training with me, rather than going all the way from where you are now, contact napping, feeding or settling your baby through bouncing or rocking, to putting them in the cot and walking out the room, we're just going to take very small steps to reach that point. It's like going from the first floor to the bottom floor, using the stairs rather than jumping out the window. It gets to the same result, but it's far less painful for both of you. So what else? Self-settling. I think this is an important thing because everybody has their own ideas. Self-settling is your baby being able to go into their cot fully awake and go to sleep on their own without any help. It's not getting them till drowsy. It's not putting them down after they've had a bottle where they go sleep immediately. No feeding before, no staying in the room, no patting them in the cot. That's not self-settling. Once they can go into their cot, no matter what their mood, without any help before, and going to sleep on their own, that is when they'll be able to resettle from sleep cycles for naps, so lengthen them, resettle early morning, so sleep longer in the morning, and resettle with the wakes overnight. So how can they do this? This is where my CALM approach comes in. So CALM stands for consistent. So we need one consistent approach that everybody can stick to. We need it to be achievable. So we need the steps to be achievable for both you and your baby. Small steps so you feel comfortable so that you can remain consistent throughout the process. We want it to be a loving process. We need the process to be loving. Lots of parents describe my program as a bonding experience for them and their baby, because you are there supporting them. You're there helping them through that process. And we want it to be manageable so that all of the above can be achieved. So rather than going, the difference between my programs is we want to make sure that it's going to work. So the first thing is preparation. You wouldn't go and move house and just suddenly wake up in the morning and think, right, I'm going to move house. You would prepare everything. You would pack the boxes, you do all of that. So we want to do a little bit of preparation. This is just a little snippet. I'm trying to give you as much information as I possibly can tonight. But we want to make sure that it's achievable for you. So it is always harder for the parent in these situations. And as long as you are confident with the changes, then your baby will adapt. Sleep training is hard. Even with gentle sleep training, you're changing what is normal for you. You are changing your normal and stepping out of your comfort zone, especially when you're exhausted, you're a new parent, you've got all of these hormones going around. It's a massive change. And then suddenly deciding, right, I'm going to step out my comfort zone. It's not an easy process. So we need to remember why you need this change. So what I want you to do now, but at some point before you start, is I want you to note 3 reasons why you are here. 3 reasons why you need this change. This could be that I want my evenings back because I want to spend time with my partner. I want my partner back in bed with me. I want somebody else to be able to settle my baby. I want to be able to get things done in the daytime, so I don't want to contact nap. I need time with my toddler. So whatever it is, the reasons why you need to change, and then I want to turn those into a visualization. So at the end of the program, I'm going to be putting my baby in bed and walking downstairs and having an evening with my partner. And do that because these are going to be really important when you're going through the process, because you'll be able to look back and think, this is why I'm here, and that will give you the want and the need to continue. Also, go to Trustpilot, have a look at Sleep Well with Hannah and read some testimonials. Don't just take my word for it that it will work. There was a few testimonials here. I'm going to skip forward. This is sometimes a longer presentation, but just to show you that this does work. And this was just from my free workshop. So I offer a free workshop, and these were the testimonials just from that free workshop. So just from the information that I'm giving to you this evening, people have been able to get to self-settling. They've been able to eliminate feeding to sleep. They've been able to get their partners involved. They've been able to move forward from contact napping. So it does work. The other thing we need to look at is preparation for your baby. If you just go straight into a setting and think, right, okay, my baby's going to go to sleep now, I'm going to pop them in the cot, or I'm going to get them to go to sleep without any preparation, then again, you're going to be setting up for fail. So feeding and sleeping and eating are so connected. In fact, the first time that I started helping babies with sleep was when I was a principal paediatric nutritional therapist for the National Nutrition Clinic in London. And I had toddlers and babies coming through my doors with lots and lots of different feeding issues, everything from feeding aversion, weaning, fussy eating, poor weight gain, reflux, cow's milk protein allergy. So I was seeing them for feeding issues. And actually, in 90% of the cases, I could not resolve it without addressing sleeping. And the reason for that is because sleeping and feeding are so connected. If you've got a baby that's feeding 10 times a night, they're not going to be weaning well in the daytime. And if they're not weaning well in the daytime, then how can you reduce down the overnight feeds? So we need to make sure that there's a time in the day that you can practice your baby going to sleep without feeding if you are feeding them, or where they've got a time enough to nap without you feeding. And in order to do that, we have to look at their general routine. I hate the word routine, but a more predictable day. Very, very small bit about weaning. Food wants to be having a positive effect on your baby's calories. So 100 grams of milk is 70 calories, 100 grams of broccoli is 25 calories, 100 grams of avocado is 170 calories. So you can see how different foods will have a different impact on your baby's calories. So especially if you've got a baby that's feeding to sleep or feeding overnight, then this is something to really consider. So get those really good quality high calorie foods in. You also want them to be gentle on their tummy. Cereals, nightshade, sugar can cause constipation, can cause inflammation, can cause tummy ache, which can also have an impact on sleep. So we want the foods that they're gentle on their tummy but nice, and filling them up with the calories in order to help with their sleep. So things like avocado, sweet potato and coconut, meat, fish, olive oil, nut butters, egg yolk, parsnip. So if baby is weaned, get a couple of those foods on the go, as long as they're not allergic. The other thing from a routine point of view is we want to have a look at timings. We are just focusing for this workshop, for this practical solution for your baby's sleep. We want to just show you that your baby can move forward, that they can adapt well. So I just want you to have a look at the first nap of the day, from when your baby wakes up to the first nap, so that first part of the day. If your baby is above weaning age, I want you to wait, change, offer a milk feed around an hour later, breakfast with the foods, and then nap when tired. I'm going to talk about how you get your baby to sleep in just a moment. Offer another snack before breakfast if your baby's awake for more than an hour, and if your baby is even older, say they're 12 months and they get to lunchtime, then offer lunch. But what the most important thing is, no matter how old your baby, whether or not they're 6 months or whether they're 2, you are not giving them a milk feed, a breastfeed or a bottle, but after they've had their first one when they wake up in the morning, until they've gone to sleep and woken up again. If they're not weaned, I want you to wake up in the morning, wait for their feed. When your baby asks, or 30 minutes later, offer milk, then they're going to have a play and then nap when tired. So again, in a non-weaned baby, you're not going to be feeding them until after they wake up from their nap when you practiced it. There is a really good reason for that. The first thing is babies that are being fed to sleep, and if that's the way that you're getting your baby to go to sleep, their feeding and sleep cues will be absolutely identical. They'll start rooting, they'll get grumpy, they'll start looking for the breast or looking for the bottle, and they'll start sucking. But then if they then have the breast or bottle, they're going to fall asleep on it, and then you've missed your chance to have a practice. So we need to make sure that you don't feed before they've gone to sleep. And if your baby is only 5 months old, then they'll probably only have 45 minutes of wake time. So it's more than manageable for them to be able to have a nap after, once we've had a feed, nap, and then feed. And again, but if your baby is 10 months old, then they wake up in the morning, they might go 3 hours. But if they wake up in the morning, they've had their feed, then they've had their breakfast, and then they've had a snack, and then they go down for a nap. So they can still wait until after that first nap. So the next thing, just before we go into how you're going to change how your baby's going to sleep, is the process. And this is a quote that was posted on my Instagram actually a little while ago, and it said, "Sleep training is a load of shit, and I feed my baby and my husband rocks. That's the only natural way." So I'd like to point out that this parent had actually sleep trained their baby, not using my approach, but in my context, in the fact that her baby was probably always fed to sleep until one point, and then her husband rocked the baby to sleep. And that's all we're doing in this process. We are moving forward slowly from how you are getting the baby to go to sleep. And so rocking rather than feeding is a step forward on that ladder of sleep training. This is a loving process. You will always be there supporting your baby. You are therefore more likely to stick to it. It's easier for the baby to make the changes. It takes a little bit longer because you've got a number of steps but you will still get to the finish line, and you're more likely to get to that finish line. There'll be less regressions, and when you know if there are regressions, you'll be able to resolve them because you can just go back a couple of steps. And you never need to leave your baby to cry. You're there for them the whole time, supporting, helping and loving them, and it's often described as a bonding experience. And all we're doing is accelerating a natural progression. I want to explain that last point just a little bit more. When parents come to me when their baby's 3 months old, they're often walking around with baby or feeding them. When they get to around 6 or 7 months old, the parents are sat down because it's back-breaking for them to be standing up on a gym ball or on the edge of the bed or on a rocking chair. When they get to around 12 months, they're lying down on the bed because they can't sit up anymore. And all we're doing with the sleep training is just slowly, we're accelerating that natural progress. So what I want you to do, moving on to the next slide, is to make sure that you're going to make a manageable step forward. So what I want to do with this is I want you to prove that you can get your baby to adapt to another way of going to sleep. Because if you can prove they can do it once, they can do it 5 times or 10 times to get to that finish line. So I want you to look for tired signs. So your baby's woken up in the morning, they have had a milk feed. If they're weaned, they've had breakfast. If they're older, they've also had a snack. If they're even older, they've even had lunch. And I want you to look for tired signs. I need you to do lots of active play. This is not a time for kind of winding down and having quiet time. The more active babies are leading up to bedtime, the better. It releases endorphins. Endorphins are brilliant for sleep. This has been proven scientifically more recently. It's something that I've been advising for years, but more recently it has been proved scientifically. So no winding down, lots and lots of active play, lots and lots of running around. Final check, when your baby isn't interested in playing, they're grumpy, they're rubbing, is what I call the window in the mirror trick. Get them to look in the mirror or look outside. If they're still not interested, then it's time for sleep. At that point, you're going to then choose one technique from sleep, a small step away from your safe place. So if you're feeding now, it might be walking around with your baby. If you're walking around with your baby, it might be sitting down. If you're sitting down, it might be lying down. So just a small step forward to prove that your baby can adapt. And then you're going to get your baby to sleep using that new technique. If your baby is upset, I want you to continue. Remember, be calm, be consistent. Don't change what you're doing. You need to be that boring pushchair, that boring car seat. That's why babies sleep so well in those environments, because they don't adapt, they don't change what they're doing. I want you to, if they are really fighting you and you feel that you can't go on, or you feel that you're getting upset, pop your baby down somewhere safe. That might be in the middle of the bed, it might be in a cot, and just stay where you are and just count really slowly, and then put them back up on you and start again. Your baby is going to protest the first time you do it, but the second time will take half the time, the third time will take half the time, as long as you are consistent, calm, and you don't change what you're doing. If they are okay in the cot, then leave them there for longer. So a little bit of a recap. Write down your 3 reasons and visualization. Get some of the foods on the list if their baby is weaned. Do take a photo of this if you want to, of this slide. Focus on the first part of the day, waking up to first nap. Practice just one small step forward, because that's going to prove that your baby can adapt. And use the 3 C's. So be consistent, be calm, and be confident with your baby. Just a couple of small examples on this. When I've done these presentations before and I've had the whole screen up, and I've had one mum, and I can see that she's bouncing the baby around, and she's like trying to, and she can see that her question's coming up, and then she comes on and the baby's screaming. I'm like, don't worry, just explain to me what's happening, and I do a conversation, and really all I'm doing is trying to get her to relax. And as soon as she relaxes and stops talking, the baby stops crying, and she doesn't even really notice that the baby stops crying, and then a couple of minutes in, I'm like, what's the baby doing now? And she looks down and the baby's gone to sleep. And that's just because the baby is relaxed, or she's been relaxed, sorry. And so the baby's been able to relax. Again, I saw this time and time again when I was working in hospital, when I was a nurse, and the parents used to be there. They're stressed, the baby's poorly, they're in a strange environment. Of course they're stressed. And the baby's screaming. And whenever I had a chance, I'd go up to them and say, give me your baby, go and get some fresh air, go to the toilet, go and get something to eat. And the baby would be asleep on me in just a couple of moments, just because I was relaxed in that environment. So if you can do breathing, you can have your body language, rather than, you're not going like this with your baby, you're bouncing them nice and slowly. Focus on your breathing, focus on your body language. Just try to show your baby that everything is fine, there's nothing wrong, and this will work. Then you will move forward, and then you can then move forward again until you get to the point where your baby is self-settling to sleep in their cot on their own. While I'm going to be opening up to questions in a moment, so while I'm just going through kind of help that you can get, I'll go through the questions that you've already pop any questions that you've got into the comments box, and I'll come to them in a moment. If you need any help moving forward, I have a completely free community. The link is on the Facebook community, Sleep Well with Hannah Parenting Community, which has got 10,000 members. I have a free workshop which is pre-recorded, so if you did miss any of this, I will send the link over so that you can watch the pre-recorded workshop, which is basically this. in about 45 minutes rather than in about 20 minutes. I have lots of free downloads on combination. So if your issue isn't that your baby isn't self-settling, I've got them on early mornings, split nights, naps, feeding to sleep. So there's lots of those. And I do have 25% off my full sleep course and all of my how-to courses, which I've got on potty training, toddler behavior, new parent, dummy removal, breast to bottle, weaning, and lots more. And I do have a book coming out in February, which is really exciting as well. Good luck with the changes, and I'm going to open up to questions now. I'm just going to go through the comments box. So what I'll do is I'll stop the share so I can see everybody, and then I will have a look at the comments box, which is just closed, and I'll have a look. So 8-month-old, baby Olive, 6 months. There's lots of techniques used to get him to sleep, depending on the cues, showing, patting, singing. Yeah, so I'd say, Camille, the most important thing is to be consistent. So choose one thing at the moment, and then move forward from that. So if your typical was go-to is feeding to sleep, then maybe you do the patting or sitting down with your baby and getting them to go to sleep. Baby struggling with noon naps, following a runny nose. Sleep regressions are so common with illness. In fact, in my community, if I have someone that said, oh, my baby sleeps aggressive, the first thing I'll do is ask if they've got any teeth coming through, if they're poorly, or if they've had any vaccinations. And normally it's one of those three. It's very rare that it's not connected to something or there isn't a reason for it. And I always say as well, just a snotty nose, I always say it's often when parents get poorly from whatever their baby's had, and they say, oh no, he's just got a snotty nose. And I said, so now that you've got it, what are your external symptoms? And they're like, just a snotty nose. And I was like, what other symptoms do you have? I've got a sore throat, I've got a headache, I feel terrible, I can't sleep. And it's the same for babies as well. So just a snotty nose can mean it's just the tip of the iceberg when a baby's poorly. Our son is 7 weeks old. He only does, if anybody wants to unmute and talk to me and ask a question, then just pop your name into the comments box and I'll come to everyone in turn as well. Our son is 7 weeks old. He only does chest sleeping and feeding sleep. When we try to put him in the cot, he wakes after 5 to 15 minutes. Interested to know how we can do things differently as approach for semester. So yes, some babies, when they are smaller before the 4 month sleep, 4 to 5 month sleep regression, which is the most common and well-known sleep regression of all of the sleep regressions. And it's because of something called object permanence. It just means that your baby realizes when something has changed. So some babies before that point, if you get them to sleep and you put them down, then they'll stay asleep, but they often start waking up around that point because they realize something's happened. And the way to resolve that is going down a sleep training route and getting your baby to sleep, self-settling to sleep. So if your little one is waking up once they've been transferred, the only way to resolve that is to teach them to go to sleep in their cot, so that when they wake up over 5 to 15 minutes, they are in the same sleep environment they went to sleep in, and they can go back to sleep by themselves. I mean, I have 2 boys. One is 9 months next week and the other is 3.5. The baby only sleeps with me while breastfeeding, feeding, sleep. He doesn't sleep with anyone except me, and after he usually goes down, then 1-2 wakings before he's fully down for a long nap. The toddler does not sleep without someone in the room and wants to have a touch, until he's down. He always wakes up 2 to 3 times a night. It's exhausting. That is exhausting with the 2 of them. So with your baby and your toddler, you can apply the same principles. I do have a separate toddler course as well. And if you did want to go ahead and do one, then I would give you the other one for free. That's not a problem at all. So you wouldn't need to buy both courses, just to let you know. But the principle is the same, whether or not your baby is 7 months or whether I've worked with children that are 7 or 8 or 9, if they are relying on you to be in the room, and I've had parents that have got a 7 or 8 year old and they're saying, no, I'm only lying on the bed with them, and I was like, so what are they needing when they wake up 4 times a night? And they're like, oh, I need to go sleep. And I was like, well, that's why they are needing it, is because you're there at bedtime, so they expect you to be there overnight as well, which of course, if you are there overnight, it's not an issue. But if that's something that you don't want to do, then you need to teach them to be able to go to sleep and back to sleep independently. 7 months old always has to be rocked, nursed to sleep, and only contact naps. Yeah, absolutely. See, it's the same thing for whenever I do these talks, that 99% of the parents in there are in some way helping their baby go to sleep, which is why they're not sleeping well and why they are needing to have you to help needing to have you to help them go back to sleep as well, because it's just natural. It's like saying that you go to sleep in your bed and someone moves you somewhere else in the middle of the night, you're soon going to wake up and want to go back into your nice warm bed. And it's the same for your baby. If they're going to sleep in your arms while being nursed and rocked, and then you put them down in their cot, they're going to wake up and think, where the hell am I, and put me back in my nice warm bed, please. Sorry, in your nice warm arms, please. Just join, please pop the
Hannah, just a quick one from me. Like, it sounds like a lot of them have the same sort of issue about, as you've said, right? Like, you put them down and they wake up, or they wake up multiple times in the night. Any kind of tips that they could use, or is it really individual to their situation? Anything, any small things that could help them with that transition
With what
from
transition, sorry?
with kind of going from having to rock or help them to sleep to just kind of putting them down. Like, what are some of
exactly.
those?
So it's just taking those small steps. So applying all of the things that I said in the presentation. So making sure they've got a time in the day that they can practice where the baby isn't hungry, having a look at the preparation, and then moving forward. So, and then once they've made that move forward, then they can keep moving forward. And a typical program would be you'd go from, if you're feeding to sleep, you'd go from feeding to sleep to standing and walking around to get your baby to sleep, and then sitting down to get your baby to sleep, and then lying down on the bed next to them to get them to sleep. And then you can then cot settle them, because it's a much smaller transition going from lying down with your baby lying down on a mattress next to you to go to sleep, to your baby lying down on a mattress with you outside of the cot, in their cot, to go to sleep, than it is from you holding them, cuddling, or feeding them, or walking around with them, to them going into the cot. So the idea of the sleep training isn't just to make this small step forward and then stop. You need to keep on moving forward along that tightrope until you get to the point where you can put your baby in their cot and walk out the room. The difference with my program, rather than verbal or controlled crying, is we're taking these smaller steps rather than just putting your baby in the cot and walking out the room, which is unmanageable for a lot of babies and for a lot of parents as well.
Yeah. And how long would that take? Like, what's the time? Like, how do you say to
It
phase
depends
this
on
out?
how many steps you put in, but a typical program lasts between 2 and 4 weeks. And that's including reducing all the nighttime feeds, having a look at weaning, getting them eating better in the daytime, all of that preparation. And I think that that's a big key to having a program that works, is that preparation. If you just go in and do sleep training and you still got a baby that's feeding 10 times a night, you're not going to get to the solution of the problem. Whereas if you spend a week having a look at the routine, increasing the high calorie foods, like I said in the beginning, adding in those high calorie foods, reducing down the nighttime feeds, practicing that one technique of getting them to sleep, being consistent with what you're doing, and then going in and doing the sleep training stages. And at each stage, you're doing a little bit less for your baby, they're doing a little bit less for themselves. You will then get to the point where they're self-settling a lot more easily, with a lot less tears, and that's how you get to the point that they're self-settling to sleep. Yeah.
Yeah, thank you. I just thought I'd ask that on behalf, but there's a ton of questions here, so I'll let you move on.
Pram or car seat. I mean, it's very common, Charlotte. And like I said in the presentation, actually, a lot of babies, some babies don't, but a lot of babies do sleep well in prams and car seats. And the main reason for that is because prams and car seats are consistent with how they're holding your baby. They're in the same position, in the same way, they've got the same sensation. And so carrying over, like if you've got your baby in the pram and they cry a little bit before they go off to sleep, the pram doesn't start changing positions and feeding and things. So have that in the back of your mind when you're trying this new way of getting your baby to sleep, and just try to be that boring car seat that holds them in the same way, that rocks them in the same way, that isn't kind of responding to the crying, that's there, that's calm. Because all babies need from us to move forward and to know that things are okay is for us to be relaxed. And if they can sense that you're okay, then they will move forward. It was a counselling psychologist that I work closely with, actually, called Dr. Anna Butcher. She's amazing. And we were doing one of these talks together, and she gave a brilliant example. And she said, it's like if you're on an aeroplane and you're really nervous about flying and you go through a period of turbulence and the aeroplane's bobbing around, if you look to the air hostess or whoever you can see that's on the plane, and if they're there and they're carrying on with their job and they're carrying on delivering everything, then you're okay, you feel a lot better. Whereas if they start panicking and strapping themselves in, then you're going to be much more nervous about it. And it's the same for your baby. When you're changing your baby's sleep situation, it's something new for them, it's something that is unusual for them, and they're going to be looking to you to see that it's okay, because that's who they look to for this safety. And if you're there like this and changing things and I'm not sure what's going on and we'll give this a go, then there's no way that they're going to be able to go to sleep. Whereas if you go into this nice and relaxed and confident and say, I know that I'm here for you, I'm going to be there, I'm going to be offering you cuddles, I'm going to be offering you help, then your baby's much more likely to adapt. My son is 10 months, nearly 11. I'm up to Joanna's question here. Puts himself to sleep at night, but I need to rock him to get him to sleep in the afternoon. 90 minutes on average to put himself to sleep during the day, and very short time if I don't rock him. Want advice on sleep training for the naps? Also, why he sleeps through the night some of the time, but very few days a week. Up 2 times a night and won't go back to sleep. That bottles. Okay, so Joanna, the nap times in the daytime are really critical for overnight sleep, because it's a time where you can practice your baby going to sleep from completely awake. They're not needing to have milk before. They're not having this long drawn out bedtime routine. And so therefore naps can, I find that babies that are settling well for naps also settle well overnight. So the overnight issues that you're having will probably be because of the naps. Naps are generally harder for babies to settle for. Parents generally have a really good bedtime routine from very early on, and they start doing a bath, and then they have bottle, and then they have wind down time, and babies get very used to it. Whereas this doesn't happen for nap times. Often when babies are small, they you kind of make do with nap times, or you're out and about, or you contact napping, or baby's feeding to sleep. So in order for nap times to get better, you need to practice them. Implement what I said in the workshop. So do that waking up in the morning, the breakfast, the lots of active play, lots of endorphins going. Don't let him have a chance to have any kind of relaxing or power nap. No milk feeds leading up to the point where he then goes to sleep. That might be much later on in the morning. And then get him to sleep using a technique that you feel comfortable for. Even though your little one is going into their cot and self-settling for bedtime, I would take a step back from that. So that might be lying down on a mattress with them, or sitting in a chair with them and cuddling them. And then they should then go to sleep and then you can move forward from that. So use that as a stepping stone to get to the point where your baby's self-settling at nap time, the same as they are at bedtime. And babies that are self-settling at bedtime generally go through the process really quickly. So you could get to nap time settling in 5 to 10 days. Ashley, why does my 7-month-old stay up for 1 to 2 hours in the middle of the night when she wakes up? So Ashley, the most common reason for this is because baby isn't self-settling. So I always give the example of what you're if something normal in the middle of the night. So for example, if you get up to go to the toilet, you get back into bed and you go to sleep really quickly. If, however, you wake up with a loud bang, you get up, you investigate straight away, you find that it's a pitch that's fallen off the wall, you're then awake for an hour and a half, 2 hours, because those kind of endorphins have started going, the kind of stress hormones have started going. And it's like the same for your baby. Lots of parents say, well, they don't do it when they're in my bed, and they sleep through when I'm in my bed, or if you contact nap, they go back to sleep. If your baby wakes up and you've been there when they go to sleep, or they've been in your arms, or you've been feeding them, and then they wake up in the middle of the night and you're not there, they're like, where's mummy? And by the time you come into the room, they're too kind of like, it's too unusual for them to go back to sleep, and then they're awake for a lot longer time in the night. The other thing that causes split nights, and there is a whole talk on this in my community, Ashley, so if you want to go into my free community, search split nights, it comes up in there. The other thing is when parents are trying to aim for too longer overnight sleep. Babies at 7 months need around 10 hours overnight. So if you're aiming for 12 hours, 7 till 7 or 8 till 8, then you will then be encouraging the 2 hours of awake time in the middle of the night. So you need to also condense those overnight hours. 15-month-old breastfeeding, feeding to sleep. She'll wake up sometimes just once a night, but it can take her 2 hours to go back to sleep. I think we covered that in the last question as well. Our reason for joining is 20-month-old who used to sleep 7 till 7. Since getting ill about a month ago now, refused to settle without one of us being in the room. So again, that's great that your 20-month-old used to sleep really well. If they used to self-settle, then you should be going back to it quite easily. Sleep regression is really common with illnesses and teething. 20 months, Generally speaking, it is a time when their sleep needs do reduce massively. At 20 months, normally around 12 hours in 24 hours. So if your little one is napping in the daytime, you want to take that off of the overnight sleep. So if they're doing an hour and a half in the daytime, they only need 10 and a half hours in overnight. So don't aim for 7 till 7. Again, you'll be setting yourself up for failure with settling and with overnight sleep as well. To address this being in the room, if at the moment you're only having to sit in the room, you've only got a few steps in order to get out of the room, so sit in the room for now. Always make sure that you're doing less if baby's protesting. So if they're trying to go to sleep, you're staying in the room. That's encouraging the behavior. If your baby isn't going to sleep, then you want to be doing less. So that's when you leave the room, go back in, lie down, and then slowly move yourself out. So if you're next to the cot at the moment, then move in the middle of the room, move to the door, and then move out the room. So it's the same principles as the original sleep training. Did you have a question, Neil? I see that you've unmuted. Oh, I can't hear you. I can't hear you for some reason. It says you're unmuted. Amy, can you hear? No, can't hear you for some reason. Let me just have a look if there's anything at the bottom. Pop it into the comments box. I'm nearly finished now anyway with the questions, and I'll come to you in just a moment, Neil, and answer any further questions that you've got on that. That's not a problem at all. And leaving a toy next to your baby to help them sleep longer, and is it safe? No, it isn't. If you have a baby under the age of 12 months, they should have a completely clear cot. So no, that isn't safe to do. Nearly 3-year-old suddenly waking up really early and a 5-month-old. So 3-year-old, sorry, I don't think Alex is here anymore, so I'll skip that one if she isn't here. It looks like she's gone. If I'm wrong on that, then let me know, Alex. Pop your hand up or something. How long for a baby to get back to normal sleep routine after being ill? So really, once the acute regression normally lasts as long as the acute symptoms. So when your baby's needing painkillers, they're off their food, they're grumpy, they're clingy to you, they don't want to be put down. So that's when, and then once they kind of start getting better, they're back on their food, they're eating a little bit better, they're not as clingy, then it normally takes around a week after that, as long as you go back to what you were doing before for the sleep to get better again. Nicola, 19-month-old, was falling asleep independently, but the past 3 months has had to be held to sleep and takes a long time. He was teething and ill and had a vaccine. Hard to know if he's totally better. But he screams and is very upset when we put him in his cot and wants to be held to sleep. Yeah, so again, he's gone through so much. And at 19 months old as well, that's when the sleep kind of needs reduce as well. I would be advising to go back to basics, have a look at his general routine, make sure he's tired for his nap times, have a look at the feeding, and then choose a small step forward. If that has to be outside of the cot initially, Nicola, then that's absolutely fine. But like I said a moment ago, if your little one was previously self-settling, it shouldn't take as long to get back on track. I think the first time that you do it, it takes between 3 and 4 weeks to get to completely independently self-settling, no night feeds, etc. But if you've done it all before, it shouldn't take longer than a week to 2 weeks to get back on track again. Sophie, since starting nursery, my 10-month-old who was sleep trained is napping for less time. He doesn't take any milk in other form other than breast, so just waits all day. And as a result, we've had more night wakings. Any tips? Sophie, no, I didn't cover this actually. It's quite an interesting one. So it is really common when babies start nursery for them to refuse in the daytime, and then that increases the nighttime wakes. At 10 months old, they only need to be having 2 milk feeds in 24 hours, morning and bedtime. So you don't need to worry about your little one not having milk in the daytime. What you need to be careful of is that you're not feeding them more overnight, so they're not eating the solid foods in the daytime. So as long as they're having their milk on waking, they're having the milk before bed but away from bedtime, and then they're eating their 3 meals and snacks in the daytime, they don't need to be having that milk. If you want to keep in one nighttime feed, then you will, but I would reduce the other ones down. Use the weaning advice, so the high foods, the calorie foods, the proteins, the fats, the carbohydrates, making sure things like avocado, coconut cream, meat, fish, lentils, dal, things like that are going to really be good for making sure that your baby's got easy access to calories in the daytime, so that you can reduce down those nighttime feeds, but also making sure that you have another way of getting your little one back to sleep. Claire, once you've taken the first step and managed to rock to sleep rather than feed to sleep, how many times should you do it before making the next step? Great question, Claire. So I would say normally 3 days, 3 to 4 days on the first stage. And then if you take small steps, you can change every 2 to 3 days. If you're taking bigger steps, like for example, when you get to cot settling, then I would be advising doing that for 3 to 4 days. Oh yeah, hi, sorry, little one woke up and I had to run to the bedroom because he usually cries when I pick him up. However, this time I did not feed him, only picked him up and rocked him as he refuses to calm in the cot. That's perfect. So that's a step forward. If you normally would feed him and you rocked him this time, then that's a step forward, which is fantastic. That's really, really good in order to move forward with that. Want to say thanks, really helpful. You're more than welcome, Neil. Oh, thank you. That's what you unmuted for. Okay, perfect. No, you're more than welcome. Also would like to know if you can share the video with us, as I missed the most important part. Okay, so I mean I've got my sleep workshop video, which I'm going to be sending the link for, which goes over all of the things that I put in this presentation, and all of my courses and training are on my website, which is sleepwellwithhannah.com, and you can find me on Instagram, sleep_well_with_Hannah. And you can also find my community on Facebook, which has got lots and lots of free resources, videos and things and support. And it's a really lovely, lovely community, actually, of supportive parents. And that is Sleep Well with Hannah parenting community on Facebook. Nisha, have just turned 2-year-old who refuses to sleep and self-soothe, is currently being held with a very loud white noise playing on the speaker in the background. We tried controlled crying, but would happily cry for hours and not settle. For the afternoon nap, we would have his milk, play in the cot and self-soothe 8 out of 10 times, and nights her killer is still awake now. Okay, so the issue with nap times is that you've got the milk before, so that's something that you need to address. And it's really important as babies get older to move milk away from nap times and away from bedtime, just because it's got sugar in it and it's bad for their teeth. So you should really be brushing teeth after milk for babies over the age of 12 to 18 months. And if you need to be holding them, then just take that small step forward. So you can do this with a 2-year-old, the same as you can with a 2-month-old. Lie down on the floor next to your little one, but make sure if they're crawling around, they're not settling, you're doing less. So it makes it even more important as they get older. So what often happens when parents try to change things is they by accident encourage the protest, because when the baby is lying down and going to sleep and being really good, they don't do anything, and then they start moving around a bit and they try to keep them in one place, and then they start screaming and they start doing a little bit more, and then they start kind of throwing themselves around, and then they do more, and them doing more will encourage those protests. Whereas if you lie down with your little one and offer them the cuddles and offer them the help, and when they are doing it, you're there and you're cuddling them and you're helping them and you're supporting them, and then if they're there crawling off, screaming, grabbing at you, refusing to settle, you pop them into the cot and do less and just sit back and take it a few moments, then that protest, that doing, that kind of not settling will reduce. So you can do that with an older one as well. Charlotte, is there a recommended wake up time for a 3-month-old? Every day is different, which can be hard to get out of the house. Really depends on bedtime, Charlotte. So at 3 months old, you want to be aiming for 9-ish hours, 9.5 hours overnight. So depending on what time you like to start your day, you want to make bedtime. So really at 3 months old, babies need to have a little bit of a later bedtime. Sophie, you are more than welcome. Marianne, are you saying that feeding during the night prevents babies eat solids during the day? Absolutely. I mean, babies, I'm not against babies up until 12 months having a nighttime feed, especially if you want to as a family. I think most babies can go through the night without feeding, and that's 10 hours from around 8 to 9 months old. Some babies can go through the night from much younger than that. Some babies can go through the night from 11 weeks old. But yeah, there is nothing wrong with babies having feeds through the night. But when it impacts solids is when they are having more than 1 to 2 feeds. If they're feeding 5 times overnight, then generally speaking, the majority of babies won't be weaning onto solids well. And this is something that I have to rectify every day in my sleep programs. And the most important thing, so when it becomes an issue is if babies are feeding all through the night and then they're not weaning in the daytime. And I know that there's this kind of notion of food before one is just fun. It's probably one of the worst sayings that I see posted around forums. And the reason why I think that is the worst thing that's posted around forums is because there's so many benefits to weaning before 12 months for hand-eye coordination, chewing and biting, for speech and language development, nutrition, expanding your baby's diet, making sure that they're not fussy. All of these things are so important. It's not so important for them to be having lots of calories from foods, but it's definitely important for them to be enjoying it and for them to be taking 2 solids well. Once they get to toddler age, they do get fussier, so it is much better to address this fussiness and the weaning issues before they get to 12 to 18 months. And it is one of the best and most kind of obvious parts of the program. When you start going through and teaching a baby to sleep well, and then you start focusing on the nights and you start reducing down the nighttime feeds, and then your little one, rather than throwing all of this food that you're making on the floor, starts eating it, and they're like looking around the back of the tray and stuff to see where they put it. They've actually been eating it, and then you see it coming out in their nappies, and they start to really enjoy their food. It's really a lovely part of the program, and all parents really enjoy that part because it's something that's super obvious, and it's something that normally happens within the first week as well. So it's something that gives them that passion to keep going. Yeah, so I've never heard that. My 13-month-old drinks plenty of formula at night and refuses solids. Yeah, I mean, it just makes sense, doesn't it? Because babies are so very good at maintaining their calorie intake. I have so many parents when I was working at the National Nutrition Clinic that came in and they're like, my baby's fussy, my baby's not eating, they're failing to thrive, they've been told all of these things. Then you look at their centile chart and they're following it. And it's not that then the fussy eating is causing them to not put on weight, because they are so good at maintaining their calorie intake. That's why they follow their centile charts most of the time so well, unless they're poorly or there's something going on. And so if they are taking lots of milk, then they don't need the solids. And so if they're having 5 bottles a day, for example, then they'll probably be getting all of the calories that they need. And so therefore, they're not going to need all of those extra solids that you're trying to get them to eat. That is the end of the questions. I hope everybody found that useful to this evening. And it's been lovely having so many of you here. And thank you for those that have made it to the end. And do make sure that you fill in that form. So it's really useful.
I have a question, Hannah. For those who are worried about, it's a separation anxiety thing for children, and this is something I faced with my kids, the whole you put them down and then they cry. And I know you've mentioned you do this over 2-3 months, and then somewhere I heard a suggestion about putting something like an item of your clothing next to them to help them sort of transition, because they can still smell you or it's familiar. What are your views on tactics like that? Do they work? Do they, or because different people have different takes on these kind of things?
So firstly, I'm sure it was just a slip up on you saying it's 2 to 3 weeks, not 2 to 3 months to go through the process, just so that people aren't sitting here thinking I've got 2 to 3 months to do this.
Sorry, yes, no. 2 to 3 weeks, yes.
Yeah. So this is the beauty of the program, is that you are taking these small steps. So until you get to the point that you are walking out of that door when your baby goes to sleep, separation anxiety isn't an issue, because you're not separating yourself from your baby. Yeah, you are there the whole time with your baby in the room. Initially, you're still cuddling them, you're still holding them. So separation anxiety isn't an issue. Separation anxiety comes with sleep training. When you put your baby into the room that you previously cuddled and fed to sleep, and walk out the room and leave them for 3 minutes or 4 minutes or 5 minutes. By the time you get to the point where you're leaving the room, your baby is already used to sleeping in their cot. They've got their sleep triggers. You've reduced down the nighttime feeds. They're going to sleep with you just standing by the door after you've said goodnight, and then they're going off to sleep. That tiny bit that you're taking out of the room at that point is not a huge thing. On to your other point of doing things to make it easier for your baby. If you've got an older toddler, they do tend to like to take to a comfort thing. And up until this point, you have very much been their comfort blanket. But when you get to the point where your toddler, if you've got your toddler, then they do tend to take to something, whether that's a muslin or a small toy. You can't, and I can't advise putting pieces of clothing, toys, muslins, or anything into a cot with a baby under the age of 12 months. The only thing that you could do is if, for example, you had a cot, something with your perfume on it, and you put it underneath the cot, or you had essential oils that you sometimes use on you, and you put that near to the cot, then that might work. But I can't advise to keep putting items into the cot. I see that Anishka's raised your hand. Did you want to unmute and ask something?
Yeah, hi Hannah. Thank you so much. I just had a very quick question. So my baby is 5 months old and not ready to sleep, but with the nutrition experience. So he was on the 50th percentile, but at 4 months he fell down 1 percentile. So now is on 25
Yeah.
and is maintaining that. So what is normal? Like, should he bounce back to 58, or is it normal to just carry on that?
Yeah, they now say that your baby should follow their centile that they track between the 3 and 4 months. So if you dropped around the 4-month mark, and a lot of babies do, especially if they're breastfed, especially if they're quite active quite early, rolling quite early, then all of these things can mean that they do drop a percentile. I wouldn't be worried with dropping 1 percentile. The only time that I'd be worried if they continue to drop. If he's now tracking it, then as long as he tracks it, that's fine. Yeah.
Okay, that sounds great. Thank you.
Welcome. And you are welcome, Charlotte, and Nisha. Yeah, thank you to everybody. Thank you for having me.
Thank you so much, Anna, for joining us this evening. I think that was super helpful, clearly. I see that 9 forms have been filled, but there were 23 or 26 of you. So please do so if you haven't already, or I'll wait for another few minutes. But if you do have questions for Hannah, she has put down or want to join her list. Hannah, if you want, what I can do is I can circulate that slide, which has your contact details to the mailing list of people who
and if
joined
you
up.
want me to, I can send you the link to my free workshop and community that you can send out so that everybody knows where to find me. Yeah,
absolutely. Yeah, please do so. Thank
I'll
you so
email
much. We
that.
finished bang on time,
Okay,
which is fantastic.
okay, take care.
Take
Bye-bye.
care. Bye.
Bye.